Alright, so let's quickly talk about another medical procedure or surgical procedure rather, which is known as what? Ileostomy. So earlier on we made videos on the concept of colostomy. Now we'll be talking about what? Ileostomy. So ileostomy is more of like they are trying to now what? Probably there's a problem with your anus or just any problem, right? So they are trying to now what? Make an opening so that feces will be collected in this what? Ileostomy bag. All right. So we get to look at it, to look at the types, indications, that's disease conditions where this type of thing is indicated. Then this is colostomy. So colostomy is different from what? Ileostomy. Ileostomy is from the small intestine. Colostomy is from the large intestine. Okay, but I'll still make a video differentiating between the concept of this ileostomy and colostomy. All right, so that's it. From the definition, we say that ileostomy is a surgical procedure which are trying to create an opening in the abdominal wall. All right, so you are trying to divert the small intestine, that's the ileum. You are diverting its contents into an external pouch, which should be collected in this bag. All right, so what are the types? There's temporal ileostomy, there's permanent ileostomy, there's loop ileostomy, there's end ileostomy, there's J pouch ileostomy. All right, indications: disease conditions where ileostomy is indicated. Okay, when the patient has ulcerative colitis, if there's Crohn's disease, there's familial what? Adenomatous what? Polyposis. There's colon cancer, there's inflammatory bowel disease, there's bowel obstruction or trauma. All right. Then surgical techniques. You can do this type of surgery using the open way. You could use it doing what? You could do it using what? Laparoscopy. You could do it using what? Robotic. Okay. Procedure. I think it's for the open one now. Abdominal incision. You mobilize the ileum. Then you create the stoma. Then you now what? Attach the pouch. Okay. So that's it. You can see this is it. Anything ileostomy is actually what? On the small intestine, right? On the small intestine, then this one is what? Jejunostomy, right? Then anything on the large intestine is what is known as what? Colostomy. Okay. Complications, of course, is a surgery, so there's risk for what? Infection, there's risk for obstruction, there's risk for prolapse, there's risk for retraction. Risks for skin irritation, nutritional deficiencies, and electrolyte imbalance. Okay. Then post-operative care, the patient might be you just try to focus on the things that the patient is complaining about. So if they complain about pain, you manage it. If they are becoming dehydrated, you resuscitate. If there is risk of infection, you give antibiotics. If there's a wound, you do a wound care, stomach care, and dietary adjustment. Okay. So that's it for the surgical procedure known as what? Ileostomy.